very good afternoon to everyone, and we are thrilled to welcome you all for today's webinar on Could It Be My Thyroid? Unliving the Secrets of Thyroid Health. So, I am your host today, Ekta Shah, and I am delighted to introduce our esteemed speaker, Dr. Usha Kiran Sisodia. With her extensive experience and expertise in clinical nutrition, will guide us through the insights of the thyroid health and provide a valuable insight on how to maintain a healthy thyroid gland. So, without any further ado, let's give a warm welcome to Dr. Usha.
Welcome you all on my show to have you ever thought, could it be my thyroid? See, actually, what happens in everyday life, every second to third person is suffering from the thyroid. So, first, we need to understand exactly how this thyroid gland works and what importance our body gives to the thyroid. Yeah, this is about me. Basically, I have presented nationally and internationally many papers, and I have experience of more than 27 years in the field of nutrition and dietetics. And we have experience of patients treated more than 1 lakh patients clinically also. So this is about me. I have few success stories also to tell you. But let's today focus is on the thyroid. Next slide. Yeah. So thyroid, where exactly it is situated? First, we should know it's a very small but very powerful butterfly-shaped gland located. You can see in front of your neck only, below the chin, and in front of the neck only. It controls many of our body's most important functions. The thyroid gland makes hormones that affects our breathing, heart rate, digestion, and body temperature. So all important functions is controlled by this thyroid gland. Yeah. So what is the main cause for thyroid? So let's understand what causes thyroid problem. So what causes thyroid to get sick or inflamed or any this thing means like not functioning well. First we need to understand what is required to function thyroid. We know that the iodine deficiency means if we are deficient in the iodine, it is having problem with our thyroid functions. And even autoimmune disease, when our immune system means our own immune system attacks the thyroid, so that becomes a very serious disorder, and such as Graves disease or Hashimoto's disease, when our own autoimmune system only attacks the thyroid. So now today our main focus will be on how we can correct our thyroid hormone functioning, and how we can include the food stuffs which will help our thyroid to function well, and how we can get cured the thyroid deficiency. So you every day you heard of the thyroid gland, but do you know what exactly it does? So let's see. It might not give it a second thought unless something goes wrong. Thyroid troubles can cause a range of unrelated problems like drastic changes in your weight. Means your weight changes, and that time you realize something is wrong with our body hormones. And this is the thyroid energy levels, digestion, and even the mood changes. So we need to understand how thyroid functions, how much iodine is needed for thyroid functions. So we need to know exactly what exact amount of thyroid every day we require in adult. In adult, an iodine deficiency of less than 10 to 20 microgram a day means less than, even if we are deficient of 10 to 20 milligram microgram, it can lead to inadequate thyroid hormone production, and it called hypothyroidism. So hypothyroidism means every day we are deficient of 10 to 20 microgram, which disturbs the normal metabolic functions like regulating our heart rate, temperature, and the body weight. Yeah, sometimes needs to be carefully monitored, and even when the mothers get pregnant, that time the this hormones again has the impact on the baby and the mother. So thyroid gland also can be affected, even it affected by the means if someone is having cancer, this gland again affected by the cancer. So every time we have to make this gland healthy functioning. So hypothyroidism can be very subtle. Means it says by this Dr. Monica, an expert on the thyroid. If a thyroid disorder is suspected, maybe because of a weight changes or the fatigue, blood tests generally help us to determine whether our thyroid functioning is normal or not. Overactive thyroid, they are often treated with the medicines as that reduce the hormone levels. But we need a correct diet also. During pregnancy, thyroid hormones can affect the health of the both mother as well as the developing babies. See, when the problem occurs, if thyroid makes too much, means sometimes body produces too much of thyroid and sometimes body produces less of thyroid. So when even if it is more or it is less, the problem is same. Yeah, so what are the how you one comes to know whether exactly I'm suffering from a thyroid, hypothyroidism, fatigue. If you get fatigue, if you get depression, you get joint and muscle pain very often. These are the signs like cold means you are not able to tolerate your cold, then slowed heart rate, then constipation, even weight gain, and even this hyperthyroidism, nervousness or irritability, trouble sleeping, muscle weakness, heat intolerance, not able to tolerate the heat, even increased sweating, then rapid and the irregular heartbeat, all are the symptoms of your thyroid disorders. Even if you get frequent bowel, means again and again you have to go to washroom, then even you get more often diarrhea, weight loss is there. So all these are the symptoms if you are really suffering from the thyroid. So one has to notice all these symptoms or either few symptoms, then you need to see your doctors. So prepare the diet chart. It's a very challenging job, especially when you are having a thyroid issue. See, know what to eat and what not to eat is a major this thing issue with each and every individual. Yeah, this success story I would like to share. A young boy, only 22 years old, he was having thyroid issues and he has put on almost 30 to 40 kg of weight in a 2 3 years. Then a mother came to me and said, "Ki means we need to lose weight because he has to go to foreign countries for the studies, further studies, higher studies." Then I helped him. I planned a diet and the lifestyle modification, and he lost 38 kg. So in 14 months, he lost 38 kg only with the correct lifestyle modification, dietary changes, and along with that right mindset. So that way we can really help. I can't see the slides. Yeah. So hypothyroidism. Then another success story I would like to share. One of our staff only was having this hypothyroidism and having uncontrolled diabetes also along with the thyroid issues. So I suggested her lifestyle modification, calculated her carbs, and given her changes in her daily routine with the proper exercise regime and the foods which are apt for the thyroid issue like iodine-rich foods and all. And she also lost 12 kg in 3 months. And her HbA1c that was 14.6, it has come down to 5.6 only in 3 months. So that way the nutrition has a play important role, especially in treating the thyroid disease. Yeah. So what is the best diet a patient can have or any individual having the thyroid issues can have? What we can see nowadays, we are getting on the social media and Insta and this Facebook and in our some or other this is research. There are so many means like advice available. But what actually is the right food choices for a particular individual is a major task. So we should not go with whatever is available on the social media. First, we need to understand our disease. Ki actually, how much I have the thyroid issues, what are my levels, and what are the other comorbidities, like I'm having a weight gain, or I'm having an indigestion issue, or I'm having a slow basal metabolic rate. So, keeping in mind all these factors, you need to consult a dietitian, and then you can include accordingly the food which are right for your body. So, thyroid diet plan, once you know exactly you are suffering from thyroid, first thing, then you need to discuss your personalized diet plan. In that first thing, a dietitian will ask your daily routine, means exactly from morning what time you get up, then what food you start eating in the breakfast, then in the lunch, then tea time, and in the dinner. And along with this, you can even say exactly the amount and the combination of the food you are eating, so that everything should be jotted by the dietitian, and then she can advise you what exactly, with your physical activity, with your age factor, with your gender factor, with your weight changes, everything she will take into account, your thyroid levels, your medication, and then the diet suggested for you will be a designer diet. So, for instance, if a person has an iodine deficiency, including the food, we need to include the food rich in the iodine, and it can help to regulate the problems, such as those who are having this selenium and the zinc rich, like you can have sesame, you can have sesame seeds, you can have pumpkin seeds, sunflower seeds. You all these can be having a zinc and the selenium. Even those who are non-vegetarians, they can have fish. They can have salmo fish. They can have some other fish also, but it should be sweet water fish. And those who are vegetarian, they can include curds, dairy products. They can include cheese. But again, it depends on the your this thing overall likes and dislikes. See, what can help you to choose the food that we need to first include one by one in our diet. There are some, generally it is a saying कि cruciferous vegetable we should not eat, like broccoli, Brussels sprouts, and cabbage, cauliflower. These we should not include, because generally they should not be eaten raw, because they interfere with the thyroid hormones functioning. So that's why we should not eat the raw. But if it is well cooked, definitely you can include your in meal.
Yeah, there is one question under the chat section. Like, may I ask to share the diet chart table for hypothyroidism concern? Uh,
Yeah.
I think, yeah, gender is female and age would be 40.
Yes, yes, I will share. I will definitely. So I'll discuss also and will share also. So there are several diet plans. Generally, everybody means gives this thing diet for hypothyroidism, but it doesn't work. Because why it doesn't work? Because the person who is giving you the diet doesn't know your lifestyle, your routine. So I will explain you in the this further slides exactly how you can introduce few foods in your diet and how you can eliminate those who are not suiting you. So one by one we will work on the elimination diet. So these are the foodstuffs generally. Like you can see this red cabbage, then kale, then green smoothie, broccoli. All this generally they say do not eat. But if it is properly cooked, you can include these foods. If it is properly cooked, please note this point. It should be cooked properly. Raw should not be eaten. So, what to do? You must find out the root cause of the problem, because there are functional medicines also, and same way functional foods also. Functional foods means actually the food items which we are eating, it has some function in the body. Suppose you are including ginger in your body. Ginger, it is anti-inflammatory. It's wonderful to increase your basal metabolic rate, and it helps in the weight loss also. So you can include ginger in your diet. So same way you can include the doctor which suggests you the medicine which will give you this thing functions particular to reduce your thyroid levels. Yeah. So there is a elimination diet concept. In that, generally those who are allergic to particular foods, or the particular foods if it's suiting or not. So one by one we have to try. Suppose wheat. Generally everybody says you stop eating chapatis. but it's not the case for the everyone. So what you can do, you can first delete wheat from your diet and see the your digestion and your overall improvement, then any allergic reaction you're getting or not, or you are getting loose motion or something like this. Something means some body always gives signals. So if there is some symptom like loose motion or digestion, bloating, or you're increasing weight, then you need to stop the wheat. If there is nothing, by eating wheat you can have wheat chapati in this. So don't just follow blindly. You mean someone has said, "Arey, stop wheat, yeah, and you will get cured," means your weight will lose and you will be this thing not having any other issues and your thyroid level will come. No, it's not the case. The simple and the best source for the thyroid hypothyroid diet is to include the iodized salt, because see, thyroid disease occurs because of the deficiency of the iodine. So first you search the list of the food items which are rich in the iodine. So generally means I have means treated many thyroid patients, and generally I first thing how I do, I let you know. I take their food habits, I take their allergies, I take their weight, their height, age factor, gender factor, and other comorbidities. Suppose diabetes है, ब्लड प्रेशर है, या हार्ट इश्यूज है, या रीनल इश्यूज है, ये सारे फैक्टर्स एक साथ just jot it down on a paper. Then I take the routines. Suppose they are avoiding breakfast, they are not taking a lunch, or they are skipping this thing, tea times, they are not eating anything, or maybe late night dinners, they are eating very late night. So maybe their comorbid factor like cholesterol also may be high, maybe they are having a high waistline. There are so many things which will affect the health. So I need to correct first. If they are not having breakfast, I will include breakfast. If they are not eating the lunch on the time, then I will suggest at least have something on the lunch time. Then tea time also something nourishing, because tea time is the time when our blood sugar level drops down. So that time we need to have something nutritious like sprouts, maybe corn, maybe fruits. So you can always keep fruits. And in thyroid, we don't avoid any fruit until unless you are diabetic or you are having renal issues. So that way it is very individualized diet for a thyroid function. So always whenever whoever is suffering from the thyroid issues, first you need to consult your clinical nutritionist, and she is the right person to guide you. Yeah, so these I have included the table. You can take from the ekta. This is the iodine content of the selected food items. So these are required by our body. You can jot down all these food stuffs, and in a day you can include one or two of these tables. You can have milk, you non-fat milk. You can have yogurt. You can have whole wheat bread. You can sometimes, if you are not on the weight loss diet, you can include ice cream also. You can have cheese cheddar also. Or those who are non-vegetarians, they can have fish also. Means light, but in a quantity. It should be in a specific quantity and it should go with your diet. So this you can take from the ekta. Yeah. Next slide, or you can click a snap. So again, continue from that side. Oats also you can include in your diet. You can include apple juice. You can include, but all these things just don't include by your own. Just consult one's dietitian, understand your thyroid functioning and the comorbid factors, maybe diabetes, maybe blood pressure, maybe constipation, maybe acidity. These all factors have a effect on your health. So here the recommended amount means every day one how much one should have. So these are the our this thing requirement. Suppose I should have 1 gram per kg body weight proteins. I'm telling for protein, not for thyroid. Same way for thyroid also, body has requirement. So the requirements are here. For the babies, it is only 130 microgram for the male child, 130 for the female, matlab male female both same till 1 year. Then 1 to 3 again it is same. Till 14 to 18, the total requirement is 150 microgram for both the genders. And then during pregnancy, you can see during pregnancy, the requirement increases for this iodine. So you need to be aware about exactly how much iodine you are required for a normal functioning of the thyroid gland. And this is immunity booster drinks I have included for all of you. So it will help to function thyroid normal. You can have beetroot juice. You can have this turmeric tea, or you can have ginger tea, amla, orange juice. You can include. You can have kada also. Yeah. So food is a medicine. I will conclude by this slide, and thank you very much for the patience hearing. Now I can take your questions.
So, Dr. Usha, I'll just help you out in reading out these questions. So
Yeah,
the
yeah, yeah.
first,
That would be great. That would be great. Yeah.
yeah. So the first question is, how do we read thyroid reports such as free 3 T3, T4, and TSH? My wife, who is pregnant, recently had a thyroid test where T3 and T4 levels were normal, but TSH was positive by 0.015. Will she be
Yeah.
diagnosed with a thyroid condition? And
See
if
what
yes, then
happens.
it is dangerous for a growing baby.
See what happens is how to read these reports. Basically, we have always been given a normal range along with our readings. If it falls under the normal, because it has the three parts T3, T4, and TSH. If suppose TSH little on this thing point zero one point, then you need to first consult the doctor. So doctor will, if it is required according to body weight and this thing, he will give minimum dose, just safer side. It will not affect the child also, and then in the diet we can make the changes, so person can have a full energy level and weight under control, and everything is under control. Hmm?
So next question is, to conceive, what should be TSH level?
See, for conception, actually, generally, before conception only, doctor sees whether everything falls under control or not. So, in the range, if it is there, your TSH, T3, T4, definitely safely you can go for conception. And in case if your readings are little here, there, then you need to start a medicine. So, you can get in conception, you will not get any issues. So nothing to worry for this thing. Only thing is the pre-medical test before conception. Doctor always advise to the patient.
What if TSH has been continuously maintaining between 6 to 6.5 levels even after
Hmm.
using medicines?
See, if even after using it means you need to modify your lifestyle also. You are only relying only on the tablets, medicine. So just review your diet. कि exactly in diet what's going means so how much iodine you can get calculated by help of the clinical nutritionist. And then once you know means your this thing food items you need to make some changes here and there in breakfast, lunch, or tea time. Then you can go healthy way.
So we move to the next question, which
Yes.
is it fine if we consult a general physician or a
Mhm.
specialized endocrinologist? How frequently should we have out a thyroid levels checked?
See, if everything is going right, means your energy level is perfect, you are feeling all the time high in energy, you are in digestion issue, no there, you are not having any weight gain, and nothing means you, then I don't think you need to go to any doctor if everything is under control. And if you feel you are drooping in energy, your weight is increasing, all of a sudden weight has increased, then you are feeling depression, maybe having anxiety, maybe having too often loose motions or diarrhea, something means something unusual and giving you weakness. If you feel weak from inside also, then these are the signs कि you should consult a normal physician. First thing is always normal physician. If the normal physician can't rule out, then go for your specialist.
So there is one more question on, please suggest diet for hyperthyroid diagnosed situation.
Yeah. So I just want to know one more thing. The hyperthyroid person is underweight because in that weight loss is there. So if it is underweight, then we have to correct the weight issue along with the thyroid functioning. Both should be go hand in hand because hyperthyroidism weight loss is there, and in hypothyroidism weight gain is there.
Should I read out the second question?
Yeah, yeah.
Yeah. So is thyroid affected people continue use the medicine lifelong? Does
No, no,
they
no.
require?
Now it is not like that. Nowadays, when thyroid levels are under control with the lifestyle modification, with the diet, and with the medicine, all these things, then doctor generally either stop the medicine or they just keep on minimum level. Because I have seen my many patients, they have stopped the medicine, they are living a total normal life. Like in diabetes also nowadays, if your blood, this thing glycosylated hemoglobin is 6 or 6.5, then doctor doesn't give any medicine for diabetic patient. Next.
So, can we maintain thyroid without thyroxine when we can stop the medicine?
See, if for 2, 3 readings, like you have continuously every second month you are repeated your thyroid level, then they are under range, totally under range. Then the doctor will definitely will help you to either stop the medicine or to just reduce the minimum doses.
How
Ah.
often we should test thyroid levels?
See, that's what I'm saying. Like how general health checkup is being done once a year. So once a year, if you check, that is more than enough. Not very often.
So, can thyroid be permanently cured just by food habits?
Of course, thyroid can be cured or can be kept under control. Means instead of saying cured, kept under control for throughout your life with your right lifestyle, right food choices, and with the yoga and alternative medicine, means like right mindset. If you are following a particular system, having this physical activity, you are doing yoga also, you are doing small this thing exercise, maybe stretches, maybe balloon, not necessary to go to gym. And in a day, if you are taking a balanced meal means you are having enough fruits, enough milk and milk product, then cereals and pulses, then even this mini small micronutrients, maybe these all seeds and everything. And along with that, if you are weight under control, definitely you can keep your thyroid under control, like diabetes.
So, doctor, there is a saying that a person with a thyroid issue should never stop their medicine, even the thyroid levels become normal. So, is it true?
See, nowadays it is not true. Nowadays, every definition is getting changed for everything. Previously, it was like the diabetes once comes doesn't go. No, diabetes can be under control. The correct word is diabetes can always be under control with the right lifestyle, right food, and the physical activity. Same way, thyroid also once it comes, it can get under control with the proper diet and lifestyle modification. And of course, before stopping any medicine or any treatment for this, you have to consult a doctor. You have to take your doctor also under confidence, and you have to show the result. Means you have to show constant the thyroid levels normal. If it is constantly under normal, I don't find any reason to continue the medicine. Yeah. What are the next question? Can anybody can tell me? Do we have to get our thyroid levels checked with the taking the medicine or without taking? See, if you are getting thyroid level checked, you should not take medicine. Then only I feel you will get the correct result. Because if you are taking the medicine, your thyroid will come under control. Then what is it? I have TSH high and started using the thyronorm. Okay, as per the doctor prescription, right? I came down from 11.029 to 6.3. Okay, in 4 months. And my question is, yeah, where that has gone? My question 6.0. Okay, 4 months, and I have active life, and I will be playing badminton, okay, yoga also, but I always feel fatigue. Is it because of thyroid? No, it is not because of the thyroid, my dear. I think your diet need to be monitored. You need to include some electrolytes in your this thing diet. Maybe some nimbu pani with salt and pepper. Then you can include some fruits in your diet. You can include dairy products, and then again you see if still fatigue is there, include some dates, then monitor if you are taking breakfast or not. So that all factors affect this thing, your energy levels. So you need to correct diet also along with the medicine. You will not feel fatigue. That is my guarantee. Continuous use thyroid medicine may it will affect liver. See, there is a one simple thought I will tell you. Any medicine, even if you take simple crocin, it has an effect on your liver. So same way, taking any medicine if you are taking, it has a side effects. Can hypothyroid be controlled by the controlling the insulin spikes? Can hypothyroid be controlled by controlling insulin spikes? See, insulin spikes are related to the your food, the carbohydrate you are eating. What carbohydrate you are eating depends on that only. So, insulin spike and hypothyroid, these two things cannot get mixed. You need to control the carbs, means you need to avoid the food stuff which increases your blood sugar, like rice, poha, suji, then many other things. So these all means affect this. So you cannot mix your insulin spikes along with this. I have high BP and I am consuming pink salt. See, salt is a salt, basically any salt, if you white salt or pink salt. So you need to means if you are a high blood pressure patient, you need to stop all the processed food, preserved food, papad, pickle, then saltwater fish. Those who are non-veg, even non-vegetarian food, these all food should be stopped if you are having a high blood pressure. So that is the main thing. And your TSH is 7.4 in my latest state. I have been told to increase the this thing iodine. Yes, so you need to increase the iodine intake by, you can include iodized salt, you can include the food system like dairy products, you can include the vegetables, you can include the pulses, that you can include and you can control your iodine deficiency. The next question is, I have thyroid from the past 8 years. Okay, and I was on homeopathy. See, basically, homeopathy treatment, I really don't comment on this because I have never known exactly in homeopathy medicine what is the composition of the pills. So I won't be able to give you justified answer. Allopathy, of course, yes. A letter I stopped as I could control from my diet. So that's a good thing. See, you can control from your diet. You only are accepting. So it's a very positive thought. Now the thyroid levels are normal from 2 years. Wonderful. But I am facing muscle pain. See, this muscle pain may be because of some food or some inflammation in your body. So try to reduce that inflammation. First, you start dry ginger powder or ginger juice and see if it really helps you. And you include some calcium rich food, some sprouts, some curds, that you include your diet and the see, and then you can again post a query to me through ECTA. Okay. What kind of major food item we should avoid if we are facing thyroid? And also, no, see, first of all, you stop all junk foods, and then in non-veg also, generally I suggest not to have this non-veg. If you are having thyroid issue, first control your weight, and to control your weight you need to include high fiber food in your diet. So that will be this thing, my reply for this. At the age of 14, if 13, if this is, what is it, 13 is 0.77 and T4, okay, T3 is 0.77, T4 is 4.2, then any medication required. See, you need to first show to your doctor and then you can get back to me for this, because I don't think medicine is required. As informed, I have high BP and I am consuming pink salt. Yeah, I have given for this reply. I have replied this.
Pooja Ashwati is having a question.
Yeah, tell me.
Yeah, is TSH is 6.424, then what would you be suggesting?
Yeah, 6.24. I feel you make some, if there is a weight is more, then reduce the weight. If there is some other comorbid factor, first you treat those factors and repeat your TSH again. And I think if it should come normal, or you can just start the minimum dose with the doctor's help. That's it. See, without doctor's consent, never stop any medicine. You have to take consent from your doctor. And then if he says yes, then definitely go ahead. See, basically dairy products you should include in your diet. you should include all sprouts types of. You can have millets in your diets. You can even have this vegetables which are seasonal vegetables, and all fruits you can have. But if person is diabetic, no banana, no custard apple, no chiku, no mango, no fruit juices, and no cold drinks. You need to even stop rice, poha, suji item if you are diabetic. So first get your sugar under control. If it is under control, then you can reduce weight also, and your hormonal imbalance also can be this thing balanced if you are regularly taking advice of a clinical nutritionist, I would say.
Thank you so much for agreeing to doing this
Okay,
session.
one question I.
Thank you so much everyone for joining
Yeah,
the
thank you,
session
Ekta.
today.
Yeah, thanks.